Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. The nurse prepares an injection that is irritating to the subcutaneous tissue. Which of the following is the best action in order to prevent tracking of the medication? Option A. Use a small gauge needle. Option B. Apply ice on the injection site. Option C. Administer at a 45 degrees angle. Option D. Use the Z-track technique. Right answer is Option D. Use the Z-track technique. During the procedure, skin and tissue are pulled and held firmly while a long needle is inserted into the muscle. After the medication is injected, the skin and tissue are released. The needle track that forms during this procedure takes the shape of the letter Z, which gives the procedure its name. This zigzag track line is what prevents medication from leaking from the muscle into surrounding tissue. The most appropriate nursing order for a patient who develops dyspnea and shortness of breath would be: Option A. Maintain the patient on strict bed rest at all times. Option B. Maintain the patient in an orthopneic position as needed. Option C. Administer oxygen by Venturi mask at 24% as needed. Option D. Allow a 1-hour rest period between activities. Right answer is Option B. Maintain the patient in an orthopneic position as needed. When a patient develops dyspnea and shortness of breath, the orthopneic position encourages maximum chest expansion and keeps the abdominal organs from pressing against the diaphragm, thus improving ventilation. Bed rest and oxygen by Venturi mask at 24% would improve oxygenation of the tissues and cells but must be ordered by a physician. Allowing for rest periods decreases the possibility of hypoxia. The nurse observes that Mr. Adams begins to have increased difficulty breathing. She elevates the head of the bed to the high Fowler position, which decreases his respiratory distress. The nurse documents this breathing as Option A. Tachypnea. Option B. Eupnea. Option C. Orthopnea. Option D. Hyperventilation. Right answer is Option C. Orthopnea. Orthopnea is difficulty of breathing except in the upright position. Tachypnea is rapid respiration characterized by quick, shallow breaths. Eupnea is normal respiration, quiet, rhythmic, and without effort. The physician orders a platelet count to be performed on Mrs. Smith after breakfast. The nurse is responsible for Option A. Instructing the patient about this diagnostic test. Option B. Writing the order for this test. Option C. Giving the patient breakfast. Option D. All of the above. Right answer is Option C. Giving the patient breakfast. A platelet count evaluates the number of platelets in the circulating blood volume. The nurse is responsible for giving the patient breakfast at the scheduled time. The physician is responsible for instructing the patient about the test and for writing the order for the test. Mrs. Mitchell has been given a copy of her diet. The nurse discusses the foods allowed on a 500 mg low-sodium diet. These include Option A. A ham and Swiss cheese sandwich on whole wheat bread. Option B. Mashed potatoes and broiled chicken. Option C. A tossed salad with oil and vinegar and olives. Option D. Chicken bouillon. Right answer is Option B. Mashed potatoes and broiled chicken. Mashed potatoes and broiled chicken are low in natural sodium chloride. Ham, olives, and chicken bouillon contain large amounts of sodium and are contraindicated on a low-sodium diet. The physician orders a maintenance dose of 5,000 units of subcutaneous heparin, an anticoagulant, daily. Nursing responsibilities for Mrs. Mitchell now include Option A. Reviewing daily activated partial thromboplastin time, APTT, and prothrombin time. Option B. Reporting an APTT above 45 seconds to the physician. Option C. Assessing the patient for signs and symptoms of frank and occult bleeding. Option D. All of the above. Right answer is option D. All of the above. All of the identified nursing responsibilities are pertinent when a patient is receiving heparin. The normal activated partial thromboplastin time is 16 to 25 seconds and the normal prothrombin time is 12 to 15 seconds. These levels must remain within 2 to 2 and 1/2 the normal levels. All patients receiving anticoagulant therapy must be observed for signs and symptoms of frank and occult bleeding, including hemorrhage, hypotension, tachycardia, tachypnea, restlessness, pallor, cold and clammy skin, thirst and confusion. Blood pressure should be measured every 4 hours and the patient should be instructed to report promptly any bleeding that occurs with toothbrushing. BO. The 4 main concepts common to nursing that appear in each of the current conceptual models are: Option A. Person, nursing, environment, medicine. Option B. Person, health, nursing, support systems. Option C. Person, health, psychology, nursing. Option D. Person, environment, health, nursing. Right answer is option D. Person, environment, health, nursing. The focus concepts that have been accepted by all theorists as the focus of nursing practice from the time of Florence Nightingale include the person receiving nursing care, his environment, his health on the health-illness continuum, and the nursing actions necessary to meet his needs. In Maslow's hierarchy of physiologic needs, the human need of greatest priority is: Option A. Love. Option B. Elimination. Option C. Nutrition. Option D. Oxygen. Right answer is option D. Oxygen. Maslow, who defined a need as a satisfaction whose absence causes illness, considered oxygen to be the most important physiologic need. Without it, human life could not exist. According to this theory, other physiologic needs, including food, water, elimination, shelter, rest and sleep, activity and temperature regulation, must be met before proceeding to the next hierarchical levels on psychosocial needs. The family of an accident victim who has been declared brain dead seems amenable to organ donation. What should the nurse do? Option A. Discourage them from making a decision until their grief has eased. Option B. Listen to their concerns and answer their questions honestly. Option C. Encourage them to sign the consent form right away. Option D. Tell them the body will not be available for a wake or funeral. Right answer is option B. Listen to their concerns and answer their questions honestly. The brain-dead patient's family needs support and reassurance in making a decision about organ donation, because transplants are done within hours of. A new head nurse on a unit is distressed about the poor staffing on the 11 p.m. to 7 a.m. shift. What should she do? Option A. Complain to her fellow nurses. Option B. Wait until she knows more about the unit. Option C. Discuss the problem with her supervisor. Option D. Inform the staff that they must volunteer to rotate. Right answer is option C. Discuss the problem with her supervisor. Although a new head nurse should initially spend time observing the unit for its strengths and weakness, she should take action if a problem threatens patient safety. In this case, the supervisor is the resource person to approach. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.